I will be doing the head to toe assessment. I will be looking around the room to show I don't have anything. I do have a note card, and I will be putting it to the side so that I cannot see it. Hello, my name is Danielle Brown. I'm going to be your nurse for today. I'm going to wash my hands and provide privacy. I did see your gait when you walked in, so your gait is good and your mobility is good. You have already spoken to me, so I know that you can hear, that you can speak. Your posture is good because you sit up in the chair. You have good nourishment and you have good hygiene. What is your name?
Jamaica Rivers,
And where are you at?
South College,
And what year is it?
2020.
Okay, so your orientation is good. Do you mind if I go ahead and palpate your head to make sure that you don't have anything? Okay, so hair texture is good. There is no flakiness. Did you feel any tenderness?
No.
Because there's no tenderness on her head. I'll go ahead and be touching your sinuses, make sure that they're not swollen or anything. Very good. Okay, your frontal is good. Sorry. Maxillary sinus is good. I am going to go ahead and go to your eyes. So try to take off your glasses for me. Thank you. I'm going to get my pen light out. So what you're going to do? What you're going to do for the first one is the 6 cardinal positions of gaze. So what you're going to do is follow the pen, but don't move your head, just move your eyes. Okay, so that was good. So her cranial nerves 6, 3, and 4 are intact. So what we're going to do now is, would you mind moving your mask for me? So what we're going to do is make sure that your 7 and 12 cranial nerves are good. So what I'm going to ask you to do is to clench your teeth, clench your eyes, wrinkle your forehead, smile for me, puff out your cheeks, and move your tongue out and move it back and forth. Okay, so cranial nerves 7 and 12 are good. So what I'm going to do now is just look at your eyes, make sure that there's no lesions, nothing in them. Look at your pupil. Side. And look at your conjunctiva. Okay, so her conjunctiva, sclera, iris, and cornea are good. Her conjunctiva is pink, and all of it is good without any lesions or exudate. So what I'm looking at now are your ears. So try to pull off your headband for me. Okay, thank you very much. So we're going to do now, I'm going to feel your ears. Do you feel any tenderness? Okay, so no tenderness on her ears. I'm going to look inside. Okay, so in her ears, there's no discharge, there's no cerumen, or there are no lesions, and that's also for the outside as well. Again, she felt no tenderness. So now I'm going to feel for your pre and post auricular lymph nodes. So you're going to feel around. Do you feel any tenderness?
No.
Okay, so there is no tenderness in her pre and post auricular lymph nodes. What I'm going to ask you to do now is to open your jaw for me. Okay, one more time. Okay, so her mastoid, it has no edema, there are no nodules. Did you feel any tenderness whenever you open your mouth? Okay, so there's no tenderness as well. So what I'm going to do now is look to your nose. Just want to take my mask one more time, I'm sorry. Okay, so her nose is symmetrical, contour is good. I'll look at the inside. Her turbines are good, they are pink without any lesions. Oh, your penis. Would you mind blocking off one of your nostrils and breathing in for me? Breathe in for me. And do the same to the other side. Okay, so her patency is good. Everything's going to be intact. So now I'm going to look into your mouth. So first, look, her lips are pink and moisturized. Everything's good. Look inside. Okay, so her teeth are good without any indentures. Her teeth are good. Her buccal mucosa is good. Her tongue is good. Her I'm sorry. Teeth, gums, soft and hard palate, her floor, her mouth. And again, her tongue is good. Her tonsils were fine, so they are a +1. And also in regards, so now I'm gonna do neck. I'm gonna do neck. Okay, so for first look, her neck is symmetrical. There are no immediate pulsations. I'm gonna feel for your carotid artery or the carotid pulse. That seems good. Okay, these are also good. I'm gonna feel for your cervical lymph nodes. Make sure that they are non-palpable. Do you feel any tenderness? Okay, so her cervical lymph nodes are non-palpable and there's no tenderness. Oh, your muscles. Okay, so can you move your head side to side like this? Oh, sorry. That's not like that. Can you move your head forward and backwards? Okay, cool. So I'm going to push on your head and you push against my hand. Okay. Okay. Backwards. Okay. So everything is good. She has good muscle strength and it's equal bilaterally. So next I'm going to her chest. So first glance, her AP diameter is a 1 to 2. Sorry. Yes. Her AP diameter is a 1 to 2 ratio. Her skin color is good throughout, and also for her head, I would have also said that her skin color is good for her ethnicity, and that goes down to her chest as well. So again, her AP diameter is a 1 to 2. Texture is good. It is bilateral on both sides. Symmetry is also as good. So what I'm gonna do first is I'm gonna listen to your breath sounds. So what it is no, that's it. Yeah, your breath sounds. So 6 on the front, 3 on either side, and then 6 in the back. So what I should do is whenever you feel my stethoscope touch your skin, just breathe in normally. Listen to your breath. Listen to either side. Yeah, listen to your back. Turn around. No, yeah, you can. There you go. Okay, we're good. So all of her breath sounds seem to be. Oh, you picture right now. All of her breath sounds seem to be good. There are no abnormalities. I do not hear anything. Everything seems to be normal for the most part. So again, I'm sorry, and I have to check for your axillary lymph node. So do you mind to tuck your arm for me? Okay. Do you feel any tenderness? Okay, so there's no tenderness. Her axillary lymph nodes are not palpable, which that is normal. So now I'm going to move on to your heart. So I'm going to listen to your heart in 5 different points. Again, her chest is symmetrical, nothing abnormal, there's no barrel chest. Yes, I'm going to listen to your heart. Again, just breathe normally. Yeah, just breathe normally. Okay, so the first one I'm listening to is her aortic valve. Okay, then I listen to the pulmonic valve. Okay, then I will listen to the herbs point. Okay, then the tricuspid valve. And then lastly, her mitral valve. Okay, so S1, S2 are present. There's no splitting. S3, S4, and no murmurs are present. So then I'll be moving on to your jazz system. So would you mind, the jazz system?
Oh.
Okay. Would you mind scooting back for me? I think you can't see me.
You can do the other one.
Oh, the room. I mean, that's good. Yeah, that's good. Perfect. So now listen to her GI system. Again, everything's symmetrical and both is in the right spot. Everything is contoured correctly. And again, it's symmetrical, so that is a good sign. So first, I will listen to her valve system in all 4 quadrants. Then I will be doing a light palpitation and then a deep. And then I'll warn you whenever I do palpitation for the light and the deep. But first, I'm going to listen to her 4 quadrants. So all of her sounds, again, seem to be normal, nothing abnormal going on. Now we'll be doing light palpitation, make sure that I don't feel any abnormal, and everything is good to go. So try and look back for me again. Thank you. Again, I'm just doing light right now, so just kind of going through the whole cavity. Okay, so now we're doing deep. So everything seems to be good. There are no abnormalities, nothing strange going on, and nothing is not palpable, which is great. So now we'll be moving on to the neurological. So you can move your feet now for me. Okay, so what I'm asked to do first is to can you move like towards me? There we go. First thing I'm gonna ask you to do is finger and nose. Okay, so from your nose to my finger, go as fast as you can. Okay, go faster. Okay, then I'm gonna ask you on your put your hands on your thighs, move back and forth as fast as you can. Okay, thank you. And last thing I'm gonna do is have you from heel to shin, go down on each side one time. Okay, that is good, thank you. So her cerebral function is good. Then I'm gonna do light palpitation, so close your eyes for me. And whenever you feel my hands anywhere, just tell me that you feel them. Okay, so light palpitation is good. Then I'm gonna ask you to stand up for me. Okay, so I'm gonna ask you to close your eyes for me. Okay, cool. So Romberg's test is good. Also with that, her feet were together. So that is good. You can sit down. So I'm sorry, to stand back up for me. Can you turn your back towards the camera? Yeah, and then bend over for me. Touch my ankles. Thank you. Okay, so looking at her spine, it is symmetrical. Symmetrical, bilateral on both sides. So then I'm asking you one more thing for me. So can you stand on that side of the room? I'm gonna ask you to walk. to walk regularly. And then walk. I'm sorry, yeah. You. And then I'm gonna ask you to walk on your tiptoes. To both sides. There you go. Thank you. Then I'm gonna ask you to walk on your heels. There you go. Thank you. So again, musculoskeletal system is good. Gait was great. Mobility is good, so that we are good on that point. So ma'am, do you have any more concerns, or are you okay? Okay. So that would be the end. I'm sorry, you can't even see me. That would be the end of my head to assessment. I am now going to look at my note card, make sure that I didn't forget anything. Oh, on her neck. Okay, I'm sorry. Can you turn your head for me? Okay, there's no venous distension, so that is good. Core-tip pulse, when I did fill it, I didn't say that it was a +2, but it was a +2. And also for when I did for her past one, I did say that there was no tenderness, but also said that she felt no pain when I touched it as well.